Okay, so one down, 3 or 4 to go. Actually, wasn't as bad as I thought. I did have arm liposuction for lipedema today. For those that don't know, it was at Hoag Hospital in Newport Beach, and was there at 5:30. Surgery started about, I don't know, maybe closer to 9 once they got me checked in and did all that stuff. That hospital, it's like a luxury hospital, if that even exists, but you're treated like royalty. It was so awesome. Um, but it took about maybe 2.5 hours. I was going to do a wake surgery, but I guess I got a little feisty because I don't remember now, but I got a little feisty and they had to give me more medication, so pretty much put me to sleep. But no tube or anything, but wasn't as awake as I wanted to be. But that's okay. It ended up going fine. The anesthesiologist was beyond sweet. The sweetest. I had an awesome girl team, actually. I am a boy mom, so I love boys. But it's kind of cool to be in a room, surrounded by women, professional women too, that, are there to help you and also are super sweet and understand that we have anxiety and are under stress and try to comfort us. So that's super cool. So my surgeon, Dr. Ashraf, is an amazing, awesome plastic surgeon, and I'll have to get her name. I think it was Dr. Wang, was my anesthesiologist. She was amazing, and the nurses and everybody there was just great. But anyways, so I was a little feisty. Couldn't do a wake surgery as I wanted to, but I slept right through it. Woke up, and definitely one arm was pretty much immediately more painful than the other, but not too bad at all. They gave me a lot of drugs that are now wearing off a bit, but I came home in the afternoon, and because of the drugs, I felt great. Had a little bit of energy. Tried to do my walking, and then now I'm just gonna try to get a comfortable position, basically propping my arms up on these pillows at night to try to keep it elevated. Oh, that's my handy dandy scratcher. Definitely need to get one of these. The metal ones. I don't like the plastic ones, but the metal ones are awesome. And so I have both of my arms propped up on pillows. The doctor said to try to keep them elevated, of course, as much as possible. And she even wants to see me tomorrow to triple check that everything's okay. So I'm going to go to see her tomorrow, and I'm trying to schedule my MLD. But where I usually go, of course, they were booked up when I called for a couple of weeks ago, but they're going to try to fit me in. It's in Pomona for anybody that is in this area and has insurance. They take insurance. It's Casa Colina, if in Pomona, if they also take insurance if you need it, and they have MLD specialists there. So, anyways, I also was referred by an awesome Libby sister, Jen, for a mobile. I think she is, yeah, mobile MLD therapist. So I'm talking to her, and it is the middle of the holidays, so things are a bit crazy around here, but hopefully she can come out sooner than having to go to Casa Colina. If not, I'm going to do the little bit that I know of MLD. I just kind of saw some videos and stuff like that, so we're going to get that going. But so far, we'll see what the pain does in the next couple days and the swelling. But so far, it's a lot better than I thought. Isn't it usually like that? We like freak out, thinking the worst. I definitely can have medical anxiety at times. I don't know. I think it's because of so much stuff with, my mom had multiple sclerosis, and I took care of her for many years, and sadly, doctors really can't do much to help her. And would try, but there wasn't really anything to do, so we tried to have to figure out how to help her on our own. And then she had breast cancer, the poor thing, and then she had it twice, actually, and then later, as young as actually as 49, but then later on in life had a stroke, and just poor thing, went through so much in life, and I took care of her, was in a wheelchair and all the 9 yards. I helped take care of her because we had obviously a team of people. Then I have an autistic, nonverbal autistic son who I love, is amazing, but is a challenge, especially with health. Anytime he has an issue, you take him to the doctor and they're like, it's his autism. I'm like, no, it's his stomach or something else. He's in pain. And so they just want to give them medication after medication. So anyways, because of all that, I think I have a little bit of medical anxiety after COVID. You can imagine how difficult that was and dealing with all that. So, but it went well. I was hoping to do it awake. Like I said, I couldn't, and everything was amazing. But we'll see what tomorrow has and how much it swells, how much pain I'm in. I opted to just have Tylenol with codeine. Dr. Ashraf was more than willing to help to give me what I needed, with a reason, of course. But I just told her I wanted to start off with Tylenol with codeine because just like to take it slow. Yeah, basically, like I said, it wasn't as bad as I expected. Just anxiety takes over. So I'm glad I'm through that. And want to see how my arms look, obviously. But we'll have to go through the swelling and the whole swell hell, I guess they call it. Hopefully it won't be too bad. But overall, I don't know if it's the drugs talking, but I'm happy. I feel like we got through that, and ready to heal and maybe plan my second surgery, which I haven't decided what I want to do. Probably my butt shelf, because that's really a problem area for me. I carry I'm like a type 1, I guess, where most of my lipedema is around my hips and my butt area. I'm mainly a type 1, but obviously I have it in my arms and my legs and probably my stomach too, even though it's hard to tell too because I've had multiple children. And so anyways, so probably my butt shelf. Dr. Ashraf wants to wait, like I said before in another video, that she wants to wait to do the incision to see how much the skin retracts and to see how that goes. I have my little mask here so I can sleep better at night. If you're wondering what that is on my head. But yeah, I'm gonna wait. So in the meantime, I might do more lipo, like my butt shelf area, because I want to take it slow. I don't know, I've had an iron deficiency issue for decades, actually. No doctor ever diagnosed me, probably since I had my third son at 28. And they tell you, yeah, you're a little anemic, take some iron. So you take an iron for a month or two, then they do your blood work, and it barely goes into like the okay range, low, normal, and then they tell you you're fine. And then you have your next period, and a few weeks later, and then it just starts going down again. So I'm actually going to make a video about that, because that was a horrible experience I have, and so many women struggle. And I was tired, and I was just upset, depressed. They would just say, oh, it's because you have 3 kids, and you don't sleep, and yada, yada, yada. And it was such a simple fix, and I didn't find out until I was 47 or 48, which is really sad. But that's another story for another day, because I'm definitely going to make a video on that, because I know there's a lot of women that suffer. So I'm just afraid of also losing a lot of blood. And I heard there's like electrolyte shifts, and I'm going through menopause already, so my hormones are already a mess, so I don't need to feel worse than I already do. As far as, electrolyte, issues possibly, and low iron, and I think that is a big issue in this community that is not talked about enough. And doctors are fabulous, don't get me wrong, but they don't know everything. So yeah, that's kind of why I want to take it slow, because like I said, doctors usually only check hemoglobin. That's really not enough, and I don't want to have big surgeries unless I have to. Sometimes you have to, of course. High volume is totally understandable, but if since I was able to break them down, I'd rather do that, and that way when you take out fat, you take out blood, and I want to be able to recuperate and not go through having iron deficiency again, which I just fixed now in menopause. It's pretty much fixed, but so yeah, that's one of the reasons. I'm gonna go off to bed, take some medicine, see if I can get some sleep, because these medicines they give you at the hospital, I don't know if it's just me, because that's another thing. I'm sensitive to medicine, and sometimes I react in ways that other people don't. So a lot of medicines knock me out, like with minimal doses, but for some reason whatever they gave me now has me wired. But anyways, I'm going to go to bed and see if I can sleep tonight. I've kind of been used to now sleeping on my back, because my legs have so much like pain when I sleep on my side, my hip and my thigh and all that. So I kind of, I've learned to sleep on my back, so that's good. And I'm propping up my arms. Hopefully that'll keep the swelling down. And we'll see what happens. But once again, if you're enjoying this, if you like that I'm sharing my journey, even though might be a little awkward at times, please, give me a like so I know that you enjoyed it, and I'll be encouraged to make more videos to maybe inspire others to, definitely seek out conservative measures are always necessary, and lifestyle changes are very important, but sometimes, surgery can alleviate some of the discomfort we have, and I really want to be mobile. I want to stay mobile. I was mobile, and then, it got worse during menopause, so I'm hopefully over a lot of that hormonal ups and downs. So hopefully this will keep me at least from, having knee pain or hip pain or, stuff like that in the future, and keep me mobile. So anyways, I'm just gonna cut it off here because I could just yap on. I guess the drugs, just like I said, have me wired. So thanks for watching, and I'll update soon. Thanks.